Okay, so for the assessment of a postpartum patient for a vaginal assessment, you would start with the uterus and the fundus. So you want to feel right where her belly button is, and then you want to place your hand kind of below the uterus, and you just kind of want to feel around and see if it's either like a boggy feeling or if it's a firm feeling. If it's boggy, then you're going to want to massage it, and you're going to want to take your hand that you're not massaging with and put it kind of below kind of where her uterus would be, so that way it doesn't push its way towards the vagina while you're massaging it. So you want to massage it till it feels kind of firm, and then you want to see if the fundus is midline of her body or if it's to the left or to the right. Usually if it's to the left or to the right and it maybe feel a little boggy, it's going to be because her bladder is full. So you want to assess her bladder to see if it's distended or if it's kind of tender. Then you want her to get up and to go use the bathroom to let her bladder out, so that way that the fundus can contract and get firm. And then after that, you want to ask her if she has had a bowel movement, or if she's tried to have a bowel movement and there's been some pain and she might have to go, but it might just be too painful for her. So if that's the case, then you want to tell the provider that she needs a stool softener. Okay, and then after that, you want to start with her lochia, and you want to assess like the color that the lochia is, the amount that she's having. If her pad is soaked within 15 minutes, then that's a good sign of that she might be hemorrhaging from somewhere inside of her vagina. So if that does happen, you do want to notify the provider. So you want to assess the color, the amount. If there's an odor, it shouldn't be like a bad odor. It should be like an earthy odor. But if it smells like it has an infection, that's going to be something the provider needs to know. And then also, if she's passing any clots, small clots are okay. But if the clot is the size of like an egg, then that does need to be assessed and let the provider know about that. And you also need to ask your patient whenever she goes to use the restroom if she's observed any clots the size of an egg. Small ones are fine, but anything bigger, towards the size of an egg needs to be addressed. And then after that, we want to check her location, and you want to notify if it's a first, second, or third, or fourth degree laceration. And then you want to also look and see if she's got any other lacerations, or if she's bleeding excessively and it's just kind of squirting out of her vagina instead of like a little trickle. She might have a laceration inside of her vagina, and that needs to be addressed to the provider as well. So you want to assess her incision or her laceration to see if there's any redness or swelling, or if she's had any bruising, and if there's any kind of discharge coming from the laceration. There should not be any discharge at all, but if there is, then that needs to be told to the provider. And also you need to check her stitches to make sure that everything is still sewn together and that there's no holes or anything, or if there's any pop stitches, you need to look for that as well. Then you can look for a hematoma inside of the vagina, because that does happen. Sometimes they might be big enough where you can kind of see it kind of bulging out of the vagina. It'd be like a purpley color. That needs to be told to the provider as well, because that can cause her to hemorrhage on the inside of her body. Even though she won't be showing the blood coming from it, it'll be pooling up inside of her. And then you want to ask your patient about pain. If her pain is more today or more than it was within the last hour or so, you want to make sure that it's within limits on the pain scale that you're looking for. And then you also want to assess the patient to see if she does have any signs of hemorrhage, because just because she might not be bleeding doesn't mean that she's not hemorrhaging on the inside. So you need to assess for her skin. She could be like clammy, dry. She'll be have like real pale skin. Her blood pressure is going to be low, and her pulse is going to be very high. And she will be kind of restless, or she could be lethargic. It just all depends. Then after your assessment, you can change her pad and then put her back in a comfortable position. Make sure the call light is in reach, and that should be it.